Good day. Today we're going to talk about abbreviation. Abbreviation is a shortened or contracted form of a word or phrase used in place of the whole. Abbreviations are used frequently in medicine. They boost efficiency as long as they are used intelligently. Certain medication abbreviations are avoided to prevent mistakes according to best practice. With this video, you're going to learn about the do's and don'ts of abbreviation in KUH. Learning objectives. Abbreviations are not used on informed consent in patient rights documents, discharge instructions, discharge summaries, and other documents patients and families receive from the hospital about the patient's care. Policy and procedures related to abbreviation. This is based on the policy of medical records content and documentation standards. 4.3. Health providers are responsible for completing their respective notes for patients under their care. 4.7. The electronically stored and/or printed patient information must be subject to the same medical and legal requirements as the handwritten information in the patient medical record. 4.9. Documentation must be clear, concise, complete, and patient-centered and must be kept confidential. 4.11. Entries in patient medical records are only to be made by the following authorized KUH staff. 4.13. Only forms that have been approved for use by the Health Information Management or by the Forms Committee may be used within the patient's medical record. 4.14. The patient's medical record and all its content is the legal repository for the care, treatment, and services provided at KUH. 5.20.4. Legible. Any errors must be crossed out with a single horizontal line and initiated. Error should be written next to it. Erasers, correction pens, or multiple ink lines should never be used to cover an error. It must be possible to see the mistake and know that the original writer personally crossed out the word or sentence. 5.20.5. Documentation in English. Written documentation must be with a ballpoint pen. Pencils must not be used. Documentation using precise description. 5.20.7. All healthcare staff must at all times adhere to the standards of professionalism and the Organization Code of Ethics. The patient's medical record should not be used to address conflicts or interpersonal disputes. 5.19. Abbreviations. 5.19.1. Abbreviations must be kept to minimum, but if used, should always comply with the KUH list of approved abbreviations. You can see it on Appendix A. If an element is not necessary to be assessed, correct documentation must state not relevant. 5.19.1.2. The abbreviations, acronym, and symbols listed in Appendix B are prohibited from use in the clinical documentation. Policy and procedure related to abbreviation on granting informed consent and withdrawal, refusal of care. 4.17 states that in the event the person giving the informed consent is unable to write, then thumb mark, print, or X mark can take place of a signature as witnessed by both the physician and the witnesses. Appendix A. List of approved KUH abbreviations. List of do not use abbreviation. Abbreviation use do's and don'ts. From the Medical Record Content and Documentation Standards Policy and Granting Informed Consent and Withdrawal Refusal of Care Policy. Do's number 1. Do comply with the KUH list of approved abbreviations. 2. Do and must be kept to minimum use. Number 3. Do write it clear, concise, and complete. 4. Do write it legibly. Don'ts. Number 1. Don't use if the abbreviation is not in the approved list. Number 2. Don't use abbreviation on consent or any document the patient and family receive. 3. Don't use any eraser, correction pen, or multiple lines to cover an error on paper document. Thank you very much for your time. Goodbye.